Welcome everyone, welcome finally to my channel. This is True Confessions of a Real RN, and I'm so glad that you guys are here. Here is the thing about the channel though. This channel is not only for nurses. It's not only for registered nurses, although nursing is my point of reference. I've seen so many other parts of healthcare where we work interdisciplinary, and we see so many other things. So this channel, yes, I'm going to give you the truth about nursing and what is going on now and how it's changing so much. I personally don't think it's for the better, but who am I? Who cares what I think? I will present the facts to you, and you make that decision. I want this channel to be more for everyone, actually. If you play any role in the world of healthcare, whether it be a PCT, a CNA, a dentist, a dental hygienist, a nurse, RN, nurse practitioner, LPN, LVN, whatever it is, this place will be for you. I think we need somewhere where we can bring all of our information together and fight for what we really need. And I am the one to do that. I like to play games. I like to have fun. But it also helps to have somewhere to go where other people understand what your job entails. And that will be this channel. So if there's anything that you're seeing that is not getting out there, bring it on by. I will also go over a lot of things with nursing, the truth and just the truth, so help me God, about what's going on today and maybe how we can change it or maybe how we can make it better. And I have to be honest with you, with everything going on in the world, I feel that the jobs that we do, our patients also need to learn. We don't know what's going to happen from day to day. Anything can happen. So if patients are involved in their healthcare, which is what we want, which is the model we use, we want them in the center of their healthcare knowing what's going on, they also need to learn. I have had over a decade of nursing in the game. I started when I was a baby, literally. And it has changed so much in the past 2 to 3 years. It's a little scary on some ends. But there's one thing that I'm learning. The one thing that I'm learning is no matter where you go in nursing or what you're doing, whether it be bedside or law or corporate nursing, no matter what field of nursing you are in, everything is changing. And unfortunately, right now, it's not changing for the better. So I hope you guys will join me. I'm going to do on the nursing side, I'm going to discuss the different areas of nursing that other nurses don't even know about. A lot of nurses are burnt out to the core. There's no work-life balance. And it stinks that they have to go through that. But there's more than the bedside. All you need is your experience, and you can leverage that and do whatever it is you want to do in nursing. I have heard a lot of people talk about how they're leaving nursing, how it's getting bad, how it's getting worse. This is not what they signed up for. And I agree with them, especially in these past 2 to 3 years. I definitely agree with them. But there's ways around it. I want people going into nursing to think about their future. Where am I going with this? What should I do with this? It doesn't only have to be bedside and doctor's office and things like that. There's so much more where nurses are needed. And you can definitely take the experience that you have now and turn that into something that is so much easier in your life and so much better. This channel also will be for the patient. Now, I know a lot of people have graduated from WebMD University, and they know more than me, and they know more than the doctor. I get it. Congratulations. However, what you will learn, as anyone in the healthcare field, is that every single sign and symptom of a disease or illness, a lot of them, maybe 90% of them, have the same exact signs and symptoms. So don't diagnose yourself. Always speak to your doctor first before you do anything. Your doctor, your physician's assistant, your nurse practitioner, before moving on something, speak to them. Even though you graduated from WebMD University, and I know you know more than me and your doctor, there's a lot of things in life that you should present to them and give them the truth of what you're feeling, not the truth about what you've read and now feel. Hypochondriacs out there. So yeah, there's a lot to be taught. There's a lot to be done. But let's not give up on it just yet. I think it'll be best to change it, not to give up on it. It'll be best to change our process, what we focus on, what burns us out, and change it. So, welcome again to True Confessions of a Real RN. The next couple of videos, I'll have a lot of, maybe let's say, sit-down interviews with other nurses, doctors, whomever, in the healthcare field to shed some light on things that you may be able to do in the future using the experience you already have. So after, I don't know, what is it? After over a decade in the game, I have something to say. Don't get lost, don't get frustrated. New grads, do I have some information for you? I know it's very difficult to land the job that you want in the healthcare industry as a new grad, but there's tips and tricks to this. There's levels to this. There's ways of going around and getting there. So stick with me. I actually think the little tips and tricks that I have that do work, I can't say it on this platform. I can't go over it on this platform, but that's something that we will discuss on my Patreon. And you'll thank me for it later. I promise you that. That you will definitely thank me for later. So even though you're a new grad, in this climate, there's ways to do things to get you to where you want to go. You just have to know. You just have to know. And I know that a lot of people will say getting a job in the healthcare field is more about who you know, not what you know. And yes, that can definitely be true. I can agree with that. But there's more to the story, you know? Just stick with me. I got you. This is a channel that's for the patient, for the caregiver, for the doctor, for the nurse, like I said, for the pharmacist, for the nurse, lawyer, JD, whoever. There's so many ways you can go. The bedside is not the end. And there's one thing I'll leave you with that you have to know. I remember when I wanted to kind of grow and I got into the specialty I wanted. I was there for 5 years, and then I wanted to try it on my own. I traveled as a nurse for 3.5 years, and the very first thing everyone said, from doctor to nurse to whomever, you'll be back. It doesn't get any better than this. You will be back. And now I would say it's about 10 years later, I never went back. I continued to look for what would make me grow. So far, so good. So keep the faith out there, everyone. I can't wait to see you again. Like I said, so many interviews, so many ways to change nursing and move it forward and stop thinking of it in the old ways that we used to. Just got to stick with me. I'll bring everybody that I know and the information they know and their experience to help you. And for the patients out there, especially in my community, I definitely understand that we have a way of doing things, and there's a certain respect with medicine and your doctor and so on and so forth. But this day and age, this is the time where you ask questions, you don't hold things in. And I know a lot of older people who will never ask a question because they trust the doctor. They don't want to look dumb. They don't want to say something stupid and look like they don't know what the doctor's talking about. Well, half the time, I don't even know what the doctor's talking about. What are you saying? Say it in English for me, please. So if there's anything that you don't understand, hopefully we can explain it here. It won't only be me. And the point of this channel is to grow into something even bigger that will eventually help people in the future. Thank you for watching. And if you're still here, go ahead and click on another video. And if you have questions about anything in the world of nursing and health, I'll try my best to answer it for you. If I can't, I probably know somebody who can. Talk to you soon. See you on the next one.